The following segment is sponsored by Utah Fertility Center. If you and your partner want to start a family or have another child, but you're struggling with infertility, Deirdre with the Utah Fertility Center is here to discuss treatment options. Deirdre, great to see you.
Thanks for having me.
Of course. Okay, let's talk about what causes infertility. Do we know?
Well, luckily it's kind of equal opportunities, so it's not like we're picking on like one gender or another. It's about 40% of the time it can be related to issues with female side, so ovulation issues, problems with your anatomy, and things along those lines. And about 40% of the time it's on the male side and has to do with, like, sperm numbers or quality. So that leaves about 20% of the time, which is kind of that luckily smaller sliver where we do all the testing and we don't know exactly what the problem is, but fortunately there's, no matter what the problem is, usually very good treatments for each of those different situations.
Okay, good. That was my next question. What treatment options do you guys offer?
I would say the majority of the time it's fairly straightforward. Sometimes it's even something simple as treating the underlying problem, either on the male or female side. Sometimes it gets into, fertility treatment, and I would say about 75% of the time it's pretty routine treatment that's less expensive, either making somebody ovulate when, say, they're not ovulating regularly, or doing treatments to boost sperm quality and then getting a little closer up through the fallopian, through the uterus and up closer to the fallopian
Some guidance. Some guidance, for sure.
Some easier stuff, and maybe about 25% of the time that leaves some patients that if the easier things haven't worked, then we do things that are a little more advanced, like in vitro fertilization, which means everything's happening outside of the body. So we get the eggs retrieved from the body, put the egg and sperm together, grow embryos in our lab, and then actually put the embryos back right into the uterus, and that gives them a really high chance of success.
It's so good to know that there are options. And speaking of that, what is infertility preservation?
So that's a little bit different. So that would be more people that are single. It can be on the male or female side, but women, unfortunately for us, do suffer a little bit more on that along those lines, just because we're born with all of our eggs, whereas men are making sperm all the time. And so for women in particular that are thinking about family building, sometimes, especially I think these days in the culture, myself included, we wait longer, we work on our career, we want to make sure we're financially stable.
We think we have all this time.
I know, and then all of a sudden you're 40 and maybe you don't have a child yet. And so for some women in their 20s or early 30s especially is a really great time to think about freezing eggs. It used to be more experimental because eggs are a single cell, so they can be really fragile because it's hard to get an egg to freeze and thaw and make sure it survives and can create an embryo and a baby someday. But the technology for it has gotten much better, and so we actually can do quite a lot of egg freezing, and people can go play, travel, find the person of their dreams, and then come back later on and think about creating embryos. Now, of course, it's not a guarantee, but at least it gives you people think of it almost like an insurance policy in a way. So you have an option for later on down the road.
Well, and don't you think it's so important that people do not feel alone in this process, right?
Absolutely. Yes, I think that's great to emphasize. And I think the first step is just coming in. We spend a full hour just taking a history, both male and female, sometimes single people doing fertility preservation, make sure we really know the story, and then do a lot of testing. Maybe people don't even want to start treatment yet, but I think it's empowering just to know what the underlying problem is, and then you kind of have options. A lot of it is emotional. It's a big journey, and it's financially stressful at times. And so I think the other thing is there's resources out there that we have referrals
that you can help. And you have a new location opening up. Where's that?
Yes, so that's actually in Park City.
Yay!
So we have many satellite offices, but we really were excited to reach out to that community up there as it grows, and there's lots of people that need help there too.
Amazing. Well, if you need any help or resources, definitely give them a call. Deirdre, thank you so much for joining us. For all the information, great to see you.
Yeah, thanks so much.